all the distinguished, my fellow cabinet ministers and deputy ministers, DG of WHO, Dr. Gebreyesus, and Professor Sarah Anyang Agbo of the AU, and all other distinguished guests and participants. My introduction really is going to be very short. I must just say that we really appreciate all those who have responded positively to the invitation to this conference. This is the first conference of its type that we are convening in South Africa, where we are specifically focusing on the role of science, technology, and innovation in the battle against COVID-19. Much as this virus has not been with us for a long time, we are looking at work of over the last few months, perhaps maybe 6 months, 7 months at the most. But we believe that it is important that whatever experiences we may have acquired so far are able to be shared amongst ourselves. We're also doing this because our own approach as the Department of Science and Innovation and as government is that it is absolutely essential that we mobilize all scientific disciplines that may actually have a contribution to make in fighting COVID-19, that we bring them all together and we create multidisciplinary platforms to be able to tackle COVID-19. So today's conference then will actually be focusing on different parts of these experiences that we have actually gone through in South Africa, but we've also invited international guests who also will be able to share in their respective areas what work has actually been done. So we really appreciate and once more welcome to everybody. And I suppose DG, I may as well continue to indicate that unfortunately we got a message late last night that due to unavoidable urgent commitments that have arisen, the president is unfortunately not able to join us this morning. He directly spoke to me last night to say that he really apologizes because he was really looking forward to participating at this conference. And then without DG taking powers that I do not have, I want to assure yourself and all other distinguished participants that the president did indeed ask me to then read his speech today. So I'm not power grabbing. I've been assigned officially that with your permission, if you then give me that I am able to actually read the president's address, which he felt that it's very important that I read it as he had actually intended to present it here. DG?
Thank you, Minister. I think that would be appropriate that you proceed with the input that the President would have given at this meeting. Thank you very much.
Thank you very much, Director General Dr. Philip Jwaga, who is the DG of our Department of Science and Innovation. Let me also greet, in particular, the Minister of Health, Dr. Zweli Mkhize, as well as other cabinet ministers and deputy ministers present, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, the African Commissioner for Human Resources, Science and Technology, Professor Sarah Anyang Agbo, distinguished guests and participants, ladies and gentlemen. It is a great honor to address this conference on harnessing science, technology, and innovation to respond to the COVID-19 pandemic. It has just been over 6 months since the first case of coronavirus was reported, and the death toll continues to climb across the world. A number of countries, including South Africa, are experiencing significant surges in infections. At the same time, we have stepped up collaboration and solidarity. In the global race for solutions, we are pushing the frontiers of scientific research and health innovation. This is not limited to product and technology development. It also extends to the development and improvement of policies, systems, services, and delivery methods. I wish to acknowledge and thank the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, for his support and endorsement of this conference. The World Health Organization has a long-standing commitment to pursuing health innovation for the benefit of all. I also wish to thank Commissioner Sarah Anyang Agbo for her leadership. The work of the African Union Commission in response to COVID-19 has been impressive, especially its support for the African Centers for Disease Control and Prevention. South Africa continues to benefit from various international partnerships in the fight against COVID-19, including the BRICS Alliance, the International Center for Genetic Engineering and Biotechnology, and the European and Developing Countries Clinical Trials Partnership. In May this year, South Africa, as chair of the African Union, participated in the EU Commission's Global Coronavirus Pledging event. We made a commitment to co-invest in the development of diagnostics and therapeutics and in the search for a COVID-19 vaccine. We are currently in the process of finalizing a 25 million rands investment to boost Pan-African vaccine manufacturing capabilities through the African Renaissance Fund. This pandemic has put countries to the test and severely challenged the capabilities of our healthcare system. As the international community, we have been unanimous that services, supplies, products, and technologies for prevention, treatment, and care of COVID-19 must be available to all. No country must be left behind. Resource constraints pose a very real barrier to the ability of vulnerable countries to effectively manage the pandemic. And it is here that scientific innovation will play an increasingly prominent role. Science, technology, and innovation has proven to be an important tool for generating valuable insights and for the delivery of effective solutions. A platform such as this one enables scientists, governments, business, and civil society to engage in open discussion, to share experiences and best practice, and to chart the way ahead. We know that every strategy to manage COVID-19 must focus on behavioral change, and that social distancing and proper hygiene are our safest and best bets at this time. By equal measure, we must continue to work tirelessly to develop technological solutions that meet our most pressing challenge, and that is resource scarcity. One looks, for instance, at the advances in ventilator development and production in developing countries. Soon we will witness the very first ventilators produced by the South African National Ventilator Project coming off the assembly line at a factory in Cape Town. These locally produced ventilators will complement existing stock in the public and private health system and those purchased from or donated by other countries. A number of South African innovators have taken up the challenge of addressing the need for COVID-19 solutions, bulk producing hand sanitizers, developing self-screening assessment tools in local languages, and pioneering contact tracing applications. This pandemic must be a clarion call for African nations to invest in what is already a vibrant Pan-African science and innovation ecosystem. Investment in research and innovation has enabled South Africa to respond effectively to the pandemic. We've been able to support the national COVID-19 response in critical areas, including the development and provision of diagnostic tools, ventilators, and personal protective equipment, and in epidemiological modeling and data analytics. Since the outbreak of the pandemic, we've been able to harness innovations like telemedicine to protect patients and healthcare workers from exposure. The introduction of COVID Connect has enabled over 6 million citizens and healthcare workers to access information on the pandemic through mobile messaging platforms. South African researchers are working in collaboration with international vaccine developers around a potential COVID-19 vaccine. The South African Medical Research Council and the Department of Science and Innovation have provided 10 million rands funding for the first South African COVID-19 vaccine trial. Our researchers and scientists have the expertise to develop human vaccines, having been involved in the development of several other vaccines. But it isn't just in the research space that we've demonstrated capability. We also have important laboratory infrastructure. The National Health Laboratory Service has contracted with a number of universities and government-funded platforms to assist with additional capacity to conduct COVID-19 testing. We've also developed a pathway for the potential production of COVID-19 vaccines locally. South Africa is part of a traditional medicine panel set up in partnership with the World Health Organization to assist in developing protocols for various aspects of traditional medicine usage. The Medical Research Council has also brought together a number of government, academic, and industry partners to support the development and local production of diagnostic kits and reagents for COVID-19. Harnessing the potential of science, technology, and innovation for vaccine and other manufacturing is not just about security of supply. It is also about boosting local capabilities, supporting local industries, and creating jobs. Strategic partnerships in science, technology, and innovation will play an important role in our economic recovery. As we strive to rebuild and repurpose our economies, we will need to explore opportunities in sectors such as low carbon energy, the circular and green economies, smart manufacturing, and big data. There is immense potential for kickstarting economic growth in the uptake of innovation and in driving technological solutions for the delivery of services. It is crucial that we maintain the momentum of international cooperation and solidarity to ensure inclusivity, not just in the provision of life-saving therapeutics for COVID-19, but also in sustainable economic recovery. Science, technology, and innovation are key to healthier populations, productivity, and progress. It is of the utmost importance that they remain a public good. As we collectively strive to overcome this pandemic, we must share experience and expertise. We must pool resources through joint investments, data sharing, and reciprocal access to research infrastructure. We must reinforce global solidarity through science diplomacy. This conference provides a valuable platform to advance these efforts and to affirm the absolute necessity of health innovation as a vital resource for the common good. I wish you well with your deliberations. I thank you. DG, that was, and distinguished participants, that was the message from the President of the Republic of South Africa, Mr. Cyril Ramaphosa. And then with your permission, and hopefully also with the indulgence of the participants, I decided that so that we are not clumsy, I just proceed and make my own input so that I don't have to come back again. A brief input as Minister now of Science and Innovation. So my stint as the President of the Republic of South Africa has expired. Although I wasn't President, actually I was reading his speech. So allow me then, Director General, distinguished guests and participants, to start by saying this conference, as I indicated earlier, we are doing it in partnership with Minister Mkhize and the Department of Health, as well as our other entities that are part of the Department of Science and Innovation, and others that are involved in research, development, and innovation. Allow me to draw this conference directly then to the contribution of the Department of Science and Innovation to the COVID-19 response. As a department, we've been mobilizing across the national system of innovation, especially amongst its entities and the entities of sister departments, specific initiatives that are currently being fast-tracked to support the government's response to the COVID-19 crisis. These initiatives include the following. The first initiative is deploying DSI, that is Department of Science and Innovation, funded infrastructure to expand testing for COVID-19, a matter that the President has already referred to. We funded technology platforms and laboratories that possess capabilities and have conducted the preparatory work necessary to become part of the national testing network. This includes the following. The Center for Proteomic and Genomic Research has validated various testing protocols and undertaken risk assessment according to the World Health Organization guidelines. It will install a laboratory information management system as required by the National Health Laboratory Services. Testing started in April 2020. Also, the KwaZulu-Natal Research Innovation and Sequencing Platform, known as CRISP, in partnership with the Center of AIDS Program for Research in South Africa, CAPRISA, and the Africa Health Research Institute, have validated the quantitative polymerase chain reaction and sequencing protocols from 2 manufacturers for COVID-19 testing. The other initiative in this regard is that our Council for Scientific and Industrial Research, the CSIR, laboratories were repurposed to do testing in support of government's drive for a massive rollout of testing. That was part of the first in a set of initiatives. The second initiative is in biomanufacturing, which involves molecular biology enzymes, reagents, and testing kits. A local supply of reagents and kits for COVID-19 testing are being developed through initiatives and spin-out companies that are funded by our Department of Science and Innovation, Centers of Excellence, and various other programs and initiatives. This is to ensure security of supply, local manufacturing, and the creation and preservation of jobs. South Africa currently imports testing kits, and local manufacturing will also boost supplies for the continent. This work is at the South African Health Products Regulatory Authority accreditation stage, and in some cases, approval has already been granted. Some of the products were ready for use in May 2020, which is something that we are very pleased about. Our third initiative is the development of personal protective equipment, PPEs. The Product Development Technology Station at the Central University of Technology in our country has been developing personal protective equipment, especially an airway protection device for healthcare workers. The technology station has applied for the appropriate registration with the appropriate health authorities to accommodate these new products under its existing certification, supported through the Technology Innovation Agency. And this work will continue post-COVID-19. We also have another innovation hub, ENTSA, at the Nelson Mandela University, which is using 3D printing for face shield frame design and printing modifications to enable clinicians to easily replace standard A4 transparent sheets without the need for holes and adhesives. The designs are now available, we are pleased to say, through open source networks, which also, by the way, is our own modest contribution towards open science, which is even more critical at this point in time, given a pandemic like COVID-19 that we are facing. This entity at Nelson Mandela University also positioned itself to provide engineering support in our Eastern Cape province and around the country during the lockdown, so as to enable critical projects pertaining to maintenance for the power generation industry to continue. The fourth initiative out of the 6, the technology station in chemicals immediately started with the production of the first batch of 5,000 containers of hand sanitizer to be distributed to staff and placed at strategic points on our university and college campuses for students and on-campus communities to stay safe. The production of hand sanitizers will be an ongoing project until the crisis is over, with the technology station also investigating ways to assist vulnerable communities like old age homes. It also, I must add here, Program Director, that the education sector is one of the most complex testing challenges in managing COVID-19, whether to open or not, and under what circumstances to open, and what kind of preparation is there. The challenges sometimes facing rural schools and institutions with inadequate supply of water and in some instances, inadequate power supply. So we are making our own contribution towards tackling this, because if there is one thing that COVID-19 has done, not only in South Africa, but globally, it has put into sharp relief the nature and extent of inequalities between nations, as well as inequalities within nations. Our fifth initiative is our coordinating efforts for a local COVID-19 vaccine manufacturing plant, a very important initiative. We have put together a COVID-19 vaccine production task team, which includes the Technology Innovation Agency, the Department of Trade, Industry and Competition, the South African Medical Research Council, academia, as well as local vaccine and adjuvant manufacturers, BioVac, which is an entity that is 47.5% government owned, and Afrigen, which has investment from one of our state-owned entities, the Industrial Development Corporation. The aim is to get South Africa into a state of readiness to manufacture an approved COVID-19 vaccine locally. In anticipation of the huge demand, should a candidate vaccine be identified, manufacturing facilities will need to be established in different regions, and the SADC and the African continent as a whole will have to be ready. Our sixth initiative is technical support for the ventilator project. The National Ventilator Project was conceptualized by the Department of Trade, Industry and Competition in conjunction with the manufacturing circle in order to coordinate and secure a supply of locally manufactured ventilators. The systems engineering skills and experience in specifying and acquiring complex systems at the South African Radio Astronomy Observatory, which, by the way, is one of our entities in the Department of Science and Innovation, was critical in ensuring that a national user requirement and technical specification was developed for publication in the request for proposals. This team has received approximately 100 proposals. 4 potential suppliers were selected and production orders were placed with them for an initial batch of 20,000 ventilators. One of the selected suppliers was, of course, the Center for Scientific and Industrial Research, which was contracted to manufacture 2,000 non-invasive ventilators. Before I conclude, let me also add an important matter on what we've been doing on our side. And I'm not mentioning this at the end because it's the least important, but it's also because I want to pay particular emphasis. We have also mobilized as the department and as government under the auspices of the National Coronavirus Command Council that is led by our president. We've mobilized social sciences and humanities as very important components in the fight against COVID-19. Our two main entities in this regard is our Human Sciences Research Council, which is a state entity under my department, as well as the National Institute of Humanities and Social Sciences, another entity also that falls under my ministry. And we have mobilized these entities to help us understand better human and social behavior in relation to COVID-19. Already from the work that we've begun to do, there are very important lessons that we are learning. Some of these lessons, for instance, is that it is important that we pull in humanities and social sciences right from the word go in dealing with any pandemic for that matter. Because pandemics by their nature, they do not, if it's a health pandemic, but by virtue of being a pandemic, then it also becomes a social and even political phenomenon. And also what we are also learning, which in practice, which is important, is the absolute necessity of a multidisciplinary approach, as there is no single scientific discipline that can be able to deal adequately with pandemics, including COVID-19. That is why my department, we are in the process of establishing what we call an observatory, which will be a multidisciplinary team of scientists drawn from different disciplines who will come together and be able to discuss so that we are actually able to advise government better. In conclusion, therefore, I would be glad if deliberations in this conference today could help us to learn lessons on how best to manage the health and social impact of similar pandemics in the future and bring science back to the top of agenda to inform policy and decision making. We therefore value value science diplomacy, solidarity, and open science, as these will help us in fighting the war against an unseen enemy. There is a need to keep the momentum, inclusivity, and equity in the application of the science gains to improve lives, systems, and reconstruction of the economy and the related value chains. I am looking forward to be participating in this very important conference. Thank you very much.